Let's now go over the fourth emergency in first aid and we'll talk about the overdose of alcohol and aspirin. If someone has taken alcohol in overdose, what will be some of the signs and symptoms? The first thing you'll be able to recognize will be the audio, so that the smell is going to be felt. Okay, you know that this one has taken alcohol. Also, a flash face. The face will look reddish because of blood going there. The pupils will be dilated, abnormal behavior. The person is just speaking and talking nonsense. The pulse will be normal. If you take the carotid pulse or the brachial pulse or the radial pulse, you mostly see it to be normal between 60 and 100 beats per minute. But the blood pressure might be decreased. It might be less than 120 millimeters of mercury per 80 millimeters of mercury. How do you treat someone that is overtaken alcohol in overdose? If the person is found unconscious, make sure that, but they are breathing normally, make sure that you place them in a semi-prone position, as you can see here. The reason is you want to make sure that you prevent asphyxiation in case they vomit. So asphyxiation is just where you have got low oxygen in the body, and that can lead the person into being unconscious. So if the person shows signs of being in a shock, make sure that you get help immediately. Person doesn't know what is happening and everything like that. Make sure that you get medical help immediately. Make sure that you keep the airway clear and also resuscitate if necessary. You can perform a mouth to mouth if necessary if the person is not breathing like that. Also, make sure that you keep the victim warm. How about if the person has taken aspirin overdose? What will be some of the signs and symptoms? It's going to be confusion, deep respirations. Person is breathing deeply like that. Now, there's going to be increased pulse rate. Let's say the pulse will be greater than 100 beats per minute, as though someone is having tachycardia. The blood pressure might be normal, the same 120 per 80 millimeters of mercury. So the person might also vomit, and from the may vomit blood actually from bleeding of the stomach if they've taken too much aspirin. There's also going to, you see the person will be cold and with a clammy skin, convulsions, in a coma. It can actually also lead to death. So this is very much dangerous. Okay. How do you get to treat the patient? Make sure that you assess the ABC, the airway, breathing, circulation. Is the person's airway clear? Are they breathing? Is the blood circulation okay? If breathing, make sure that you maintain an open airway if the person is breathing. Put in a semi-prone position, as we saw from the previous picture. Put into the semi-prone position and also make sure that you keep the victim warm. Make sure you also note the amount of drug that is taken in case you can. Get the victim to the hospital as quickly as you can. Take the medicine container with you if there is any. Okay. So if you find the victim in a conscious state following an overdose, you may give them an emetic, a medicine that can induce vomiting. You can also give them a raw egg to induce vomiting like that. Okay. You would not do induce vomiting if the patient is unconscious. Never induce vomiting. So that will be it in the fourth part. In the next part, we'll talk about inhalation of harm substances.